guys. So tonight we have our favorite model here and we're going to do a little bit of Skinvive. Skinvive, as you know, is the new product or the newer product of the family of the Juvederm filler collection. It is not a filler, although it's a hyaluronic acid gel, but the company doesn't want to advertise it as a filler, but instead as a skin hydrator, an internal hydrator. And that's how I explain it to my patients. So whenever they come in, if the patient is not needing a lot of volume, or if it's one of your patients where you already did the volume that they needed and they're more kind of like in their maintenance phase, that's really where I'm introducing Skinvive into the practice for those patients that are already volume where they want it. Everything looks great. They're doing just their Botox or Dysport every 3 months and then a Skinvive like every 6 months. And that's what we are recommending. That's how I'm introducing it to the practice. I think it's working really well. Patients are really liking it. There's really not a lot that you will be able to actually see on the skin. It's going to be more what your patient is going to feel or how the skin is going to feel after the treatment. If you really want to have a good comparison of changes, or because there will be changes on the skin, obviously, but it's going to be very hard to pinpoint on just like a regular photograph. I think the best way to compare the skin changes after Skinvive, it will be maybe with a Visia, where you can really show kind of like those topographical changes and the pore size and all of that, like really, really in detail. I think that's the best way to kind of like compare visual changes with Skinvive. If you don't have the Visia, I will say just tell your patients that more than what they're going to see with their eyes is going to be what they're going to feel. How the skin is going to change. They're going to see that beautiful glow. And that's why we kind of like went in theory and talked about Sculptra as well, because both of them will give you a glow, although they're completely different, right? Sculptra is stimulating collagen, is giving you that little volume. Skinvive is not going to give you any volume. It's just going to hydrate the skin from within. And it's going to last you around 6 months. And what it's doing, it's kind of like activating a cell that is called aquaporin 3. And it's one of the cells that helps to communicate the glycerin in the skin. So it just kind of like hydrates and plumps the skin from within. So I tell my patients, it's like wearing a moisturizer for 6 months, that it's not going to get depleted. So it's a beautiful treatment. It's so easy to do. You'll see we're just going to mark the patient and then we're going to do tiny little droplets. The depth of injection is supposed to be deep dermis. When you're doing that treatment, you might see a little bleb, but then as soon as you palpate the bleb, it will kind of like smooth out. That's really where you want to be. You don't want to be too deep either, right? Because then you're kind of like close to vessels where we don't want to be because it's an HA filler. You don't want to be too superficial either because then you don't want to have the patient with little bumps later on. 45-degree angle. Deep dermis, that's the target. Depending on the skin texture, the skin quality of your patient, you're going to decide if you want to do 1 syringe on each cheek, so 1 ml on each cheek, or if the patient will need 1.5 ml, okay, on each cheek. So for a total of 3 syringes per treatment. Normally I've been doing 1 ml, okay, per cheek. So 2 syringes at a time. I think that's like a sweet spot for almost everybody. If you ask me who is a good patient for Skinvive, it's going to be almost everybody, right? Whoever wants hydration, it will benefit from the treatment. Obviously, just like when we talked about Sculptra, right? If it's a younger patient with more collagen and elastin and glycerin and everything in their skin, they're probably going to see better results with just the 1-in-1. I will say everybody is a good candidate for Skinvive. We know that hydrated skin is healthier skin, right? And that's why we are always so kind of like big into drinking your water and everything. The size of the pores is going to improve. It's going to feel smooth and shiny and just healthier because it's hydrated. So it's super, super fun. Same as when you are doing an HA filler, you're going to pre-screen your patients exactly the same. No autoimmune disorders, no antibiotics, no dental procedures before or after, no vaccines before or after. With JC, we know she doesn't have any of those. Thyroid, right? Medication, that's the only thing. She's a good candidate for it. For the Skinvive, we do a grid on the skin. And right now it's only approved for cheeks. Canada and some other countries out of the US have the indication for necks as well. But here in the US, it's just for the cheeks for now. We create like a little grid on the cheeks to kind of like guide us during the treatment. For the 1-in-1, so 1 ml on each cheek, you create a grid that it's kind of like 1 centimeter apart. Or for patients that need the most hydration and you're planning on doing the 1.5 mLs, you can do a tighter grid. So maybe like a 0.5 centimeter apart. I've seen some people doing it with a ruler or with a tongue depressor. I just do it by hand. It's an easy little trace, and it doesn't have to be perfect, right? It's just to guide you more or less. I've seen some injectors as well marking the syringe with a little Sharpie on the outside, kind of like halfway. So you can keep kind of like an idea of how much product you deliver, and you don't end up delivering more product on one half of the cheek and then less on the bottom or things like that. So I always recommend you to change the needle whenever you're doing it, probably like 5 or 6 pokes. It's a 32 gauge needle, so it's just like the Bobella needle that comes with the product. And they always send you some additional needles. It comes with a tray with the 2 needles, and I use 4 total. So I use the 2 that come in the tray and then 2 additional ones. And it's super, super easy. So it's going to be an easy treatment today. Any questions?
No.
Okay. You may have a little bit of bruising, just like any other injection, right? I normally do the markings, and I'll do them right now for you. But I normally do the markings, and I try to start in the lateral aspect of the face and then come medially. You can numb the patient if you want to. I don't. I give him an ice pack. I have him hold the ice pack on one side of the face while I'm drawing and cleaning the other side. And then when I finish this side, we change the ice pack on this side. The product comes premixed with lidocaine. So it's really, really an easy treatment. You're going to feel the little pokes, but it's really not bad. The reason why I start on the lateral aspect and then move medially is because if you happen to have, because in the beginning, you're kind of like getting the hold of how many or how much product to push, right? So if they end up with a little bump over here, you're smooth it out and they're not going to even bother, right? But if they end up with a bump right here on the cheek, right, then they're going to bother. So just kind of like get your kind of like the pressure that you need to put in the plunger to get that 0.05 out on the lateral aspect and then start moving medially. That's just what I do. I normally inject kind of like in the middle of each square. So it's really, really easy. This is a treatment that you should probably do a 30-minute appointment for. It's a treatment that you can easily do maybe with their Botox appointment. So it's nothing that you should take like a long time on it. It's something that it should be quick and simple. JC already, we cleaned her face, but we're going to clean with alcohol again. So what I do, I clean with alcohol. If you want to do a little bit of puricin or chlorhexidine, you can. And then I do the markings. And then while I'm doing the markings on the other side, she's going to be holding the ice pack over here. And then prior to injection, I'll just dab everything again with alcohol or puricin, and then I'll do the injections. So it's really, really simple. Hold it on this cheek. Mm-hmm. There you go. Perfect. And this is why you want to wash your face after you do the wipe. Look at how much makeup she still had after the wipe. And then if I have a patient with like the deep laugh lines or any like deeper lines that I want to address, I just go over again. I save a tiny little bit of the product at the end, and then I just go over again the little laugh lines, or if they have like, you know, like, for example, I have a dimple and I'm starting to create a little wrinkle right there. So you will go a little bit double pass on that area. So for the markings, you go around the orbital rim and then lateral canthus, probably like a centimeter in front of that preauricular area, all the way down. And then I just kind of like delineate the jawline. Now, remember that you have your facial artery, right? Or at least that branch of this facial artery coming over here. And it kind of like goes right there, right? And then it kind of like goes this way and changes name into the angular artery. So it's kind of like almost running with the nasolabial fold. So what I do, because the markings are kind of like over that area, so kind of like to stay a little bit safer, I just keep my markings kind of like a centimeter away from the nasolabial fold. because I know that's probably where the artery is going to be coming up. So I just keep it a little bit further back. Like that, maybe. I don't know if you can see that. You can see that, right? Okay, perfect. And then 1 centimeter little lines going down. I grew up with centimeters, so for me it's very easily like in my head, but 1 centimeter is around kind of like the width of your finger. That's going to be 1 centimeter. And then 1 centimeter across as well. And if you want to use your tongue depressor in the beginning, right, while you get used to it, perfectly fine. Or those little rulers, plastic rulers, just make sure that it's nice and clean, or just those disposable ones so you can change it in between each patient. So you want kind of like that grid. Okay. So this is the 1 centimeter grid. If you had a patient with more mature skin or patient that needed more hydration and you're planning on doing the 1.5 syringes, you can definitely make that grid a little bit tighter. Okay. But just what I do, just for the safety reasons, I keep my grid a little bit farther back from the nasolabial fold, just giving that artery kind of like 1 centimeter right there. And then I just treat everything else over here. Now you can change that ice pack over here. And at this point is when I would be kind of like chatting with my patient and what's going on with your life and things like that. Catching up. So again, orbital rim, lateral canthus. Then I leave my centimeter just for safety. Then delineate the jawline. 1 centimeter in front of the preauricular area. And you could go like, you know how some patients have like tiny little fine lines right here, right in front of their ear, and it bothers them. You can do a little bit right there. That's not a problem. But this is just like the protocol that they came up with. So now we're going to do the centimeters, little lines going down. And again, it doesn't have to be perfect, just kind of like a guideline. And I feel these will be kind of like when we started doing Kybella, that we were kind of like all fixated on the markings and all of that. And now we do it kind of like almost freehand. Obviously, just staying away from the really important areas. I think this will be kind of like that in the near future. Once we feel comfortable with it, we're probably not going to even do the grid in the future, but we'll see. So now I'm going to do just a little dab of chlorhexidine or Hibiclines. And if you guys have any questions, let me know. I know one of the questions that I asked during the launch of Skinvive to the doctors that have been doing it for years, it was, first of all, if there's any cases of vascular occlusions with it, right? Because it is an HA filler. It's not very common, but there are some reported. So we have to be very careful, especially with that facial artery or angular artery, right? Because we are kind of like close to it. And that's why I choose to stay a little bit away from it. That was one of my main questions. And then the other question that I asked was, you know, as we start doing lips, for example, right, that we did 1 syringe and then we went over with a second syringe, we see it lasting longer. If there was any kind of like accumulation, because if this is a treatment that they're going to be doing every 6 months, I don't want them to start getting bumps right under the skin because the product is lasting a little bit longer than normal. And they said that they haven't seen any. And there's Schultz, it's her last name. She came whenever we did the Skinvive launch to give us a training. And she said that she has a patient that she does it every 4 months, actually. Mm-hmm. So, and there's no kind of like buildup or anything like that. And it comes the same, right, as any other filler. And I feel like if the needle is dull, it's hard for you to kind of like determine the depth of the needle as well. So you don't want to be too deep or too superficial. So maybe like 5 or 6 pokes on each needle, and then we'll change it. And the goal on each poke, it's a 0.05. Okay, there we go. Ready? Let me know if you need a break, okay? Okay. Need a poke. And if you see that tiny little blip, you just mold it right away. And as soon as you touch it, it's kind of like it blends with the skin. For like a reference, right? Bulox, the product that we use for the jawline, it has 25 milligrams of HA per ml. Voluma has 20. Volure has 17.5. Bobella, the one that is really, really soft that we use for around the lips, it's 15. Skinvive is 12.5. So it's the thinnest. It's very, very thin, and we want it to be that way. Let's change the needle. So it's going to be super soft. That's why it has been giving very good results on necks and at least out of the US, right? But I'm very, very excited to have it. Remember right here, the paroti is nice and superficial, so definitely don't go too deep. How are you doing, JC?
I'm good.
0 to 10, 10 being the worst pain ever.
It's probably about a 5.
A 5? Okay.
Yeah.
So it is a little bit.
Yeah, you can feel it.
Okay.
But it's okay.
Let me change that. And the results, you're not going to see immediately, okay? 3 to 4 weeks is normally what we tell the patients for them to start feeling that super moisture, glowy, plump skin. The other thing that they mentioned during the launch of Skinvive was that even if it's not in the studies, because they didn't study it really, but a lot of the doctors that have been using it in outside of the US for years and years notice improvement with redness. So for patients with like little redness, not rosacea per se, but redness in the skin, it helped a lot. So acne scars were very, very soft as well. So it was really, really interesting to see all those pictures. But again, we cannot promise it, right? Because it wasn't studied for that, but that's what they saw in their practice, or they see in their practice. Let me change the needle. I'm going to do those 4 and then a tiny little bit right here. We're almost done with it. You're doing great.
Oh, no, I'm good.
You're good?
I'm good. I got to have pain tolerance. I'm too.
She's doing great. And I see a couple of fine lines right here on top of her, or in front of her ear. So I'm going to do a tiny drops right there. And remember, this product is so superficial. Like when I do the perioral rhytides with Bobella around the lip, I place Bobella, which is thicker than this one in theory, right? Just under the skin. And sometimes the patients can see the little blebs when they leave. And I tell them, don't worry about it. They're going to smooth out. They kind of like almost blend into the tissue. And that's how we can kind of like smooth out those little fine lines that are in the surface. So same for you, JC. If you notice anything, don't worry about it. Mm-hmm. The product is very, very soft. It's going to integrate into the tissue. And then you're not going to feel anything. And most of the time, really, what the patients are feeling immediately after that treatment is just a little bit of swelling. It looks awesome. You're going to love it. That's it. Super simple. And then at the end, I'll do a little massage with basi tracing like I always do. Mm-hmm. How was it?
That wasn't bad.
No? Not too bad? Okay. You're going to absolutely love it. Let's do the other side. Okay. Let me know if you need a break.
Okay.
Change the needle. Something that it was really interesting to me. I'm kind of like very visual when I learn. And whenever they were like explaining to us how it works and how Skinvive works, they showed us kind of like the slides of the skin, how it changes before the treatment and then 4 weeks after the treatment. And there's definitely hydration within the skin that you can see in the histological slides, which is really, really fun. Same instructions as when you do filler, right? You should tell the patient if they have any excessive swelling, excessive bruising, any bruising where we didn't inject, any bruises are painful, anything out of the normal, right? They should let you know right away. Some bruising is normal, right? But it's like an easy treatment. Patients shouldn't like swell or be super tender or anything like that. That's it. All done. There we go. And let me do a little massage. Should be an easy treatment. You don't have to schedule them for a long time or anything like that. At the end, I just do a little massage. You don't have to, but I really like just to know that the patient doesn't have any little bumps or lumps or anything like that, because normally the patients won't want to touch it after. It's better if you kind of like mold it. There we go. Or you can do, well, I like bacitracin. I don't like the arnica cream immediately after. The bacitracin is giving them a little bit of protection on the little entry points. Arnica is great. I love it, but I normally tell my patients to wait at least the first 4 hours after putting any products that don't have any kind of like an antibiotic in it. And we know that it might not be as clean. I have a couple of patients that have come back, and I mean, they're so happy with how their skin is kind of like glowing. They really do. You know me, I'm very conservative and I like to sleep at night. So whenever I do Skinvive, I try to do maybe Botox and Skinvive. You can combine it with other fillers, but God forbid something's going on. You don't know which filler caused it, right? And again, Skinvive is not supposed to be like a filler, but I will just like to know what happened, right? So I wouldn't combine it with Sculptra or laser or even like cheek filler, because if something's going on, you don't know if it was the Skinvive superficially or what vessel are we like. And then I kind of like, whenever I do a treatment, I like them to kind of like wait and see the result of that treatment first, because if I go ahead and do another treatment 2 weeks later, obviously they're going to love the results, right? But they're not going to know which one was it that gave them that result. So, but for patients that are coming from out of town or whatever, yeah, we can kind of like squeeze their treatments a little bit closer together for sure. You did great, JC, like always.
I know you said it doesn't work for 3 weeks, but I feel like her skin already looks smooth.
I know on that. Yeah, I was going to say the same thing. It might be a tiny little bit of the swelling right now. But I agree with you. Her skin looks really, really good. And again, you may feel a little bit of little bumps, right? Whenever you do your makeup tomorrow or your wash your face. After 4 hours, don't touch anything, okay? For the first 4. But you may feel some little tiny bumps. That's very normal. The product is there. It's giving a little bit of like swelling around it. So don't worry about it. So remember, no volume at all, right? Skinvive is not going to give any volume. It's just going to hydrate the skin. So it's kind of like a 6-month moisturizer. That's how I explain it to my patients. And more than what they're going to see with their eyes is what they're going to feel on their skin. The skin is going to feel smoother, softer, plumper. The size of the pores is going to shrink a little bit. Redness is going to improve a little bit. So it's awesome. But you still need your moisturizer on the outside, okay? How was it, JC?
That wasn't bad.
Not too bad? Okay. So far, a tiny little bruise right here. Tiny. That's it. I think that's all you're going to have. It looks really good. That's it. No crazy bruising, no crazy swelling. It's an easy treatment. I took my sweet time doing the grits just for the teaching purposes, but it shouldn't take you a long time. You can definitely squeeze it with your Botox treatment or your Dysport treatment. It's perfect for either a patient that has melasma, right, and cannot do any lasers, the patients that are super, super dry in the winter months, right, your patients that cannot do lasers during the summer, right, but they still need the hydration, and for those patients that are already kind of like under maintenance mode where they don't need a lot of volume, they're just maintaining their skin, maintaining their fillers, just like Jennifer was saying a minute ago, for those patients that are coming in just for the little top off, their skin kind of like booster and their Botox treatment or their neurotoxin treatment is a great addition to the treatments. So we're loving it. I think it's a great addition. I don't think we have anything else that compares to it except for the microneedling or the lasers, which some patients cannot do. And obviously without the downtime, because look at the patient. I mean, she's perfect. She can, like 4 or 6 hours later, she can do a little bit of makeup, go out to dinner, go back to work. So there's not a lot of downtime with it, which is really, really nice. and you're going to love how you feel, that your skin feels in 4 weeks. Normally, again, when I see a patient for the first time, I do a full consult, right? From fillers that they're going to need to the Sculptra and the neuromodulator every 3 or 4 months. And I always talk about the skin as well, because the skin is one of the factors that makes us look older, right? If we don't address it, right? So volume loss is one, wrinkles is the other one, the skin is the third one, big one. So I always kind of like mention what we can do for their skin. Obviously, skincare, right? I tell my patients, whatever we do in the office is just the 40%. Whatever you do at home is the 60%. So a good skincare regimen. And obviously now we have the option of this internal hydrator, right? So I think whenever you're talking about the skin quality, it's the perfect time to kind of like introduce a Skinvive to your patients. It's not an expensive treatment. We price it at $750 per treatment. So 2 syringes for $750. And, it's again, an additional like step on their routine that they can do to help the skin quality. So, I haven't had any big issues introducing it, but I think it has to do with, I've heard of people having issues introducing it, during trainings and stuff. I think it has to do with the original consult, with how you talk to a patient about the different aging factors on their skin. Because if you don't have any volume loss if you don't have any, wrinkles on the upper face, but your skin has like discoloration, large pores, big broken capillaries, and you're not going to look as good as if you have beautiful skin. So, and a lot of patients, again, for those patients that are kind of like a little bit resistant to the filler and the volume, right? This might be a good treatment for them. Younger patients, right? Sometimes they're not as good with their skin care routine because they're younger and they really don't need it that bad, or they feel like they don't need it that bad. So for those young patients, it might be a good idea just to throw in that internal hydration, right? There's definitely a niche for it. I haven't had any issues introducing it, but I think it's more the original consult.
And I do have a question here. They said that it was FDA approved for cheek smoothness.
Yes.
Have you ever used it on anyone who had like acne scars or any kind of like unevenness?
So I haven't used it for acne scar patients. I know during the launch of Skinvive in DC, they showed, not in the US, right? But they showed pictures of patients that have had a lot of improvement on acne scarring and redness as well. Again, it's not in the studies, so we cannot promise that whenever we talk about Skinvive with a patient, but they had great pictures with acne scarring and redness. Mm-hmm. So we're very excited about it.
And then you can talk about the post-procedure instructions and your normal follow-up.
So I normally don't do a follow-up unless the patients need me, right? So I always tell my patients, remember, I'm always here, right, for you. If you have any questions, we have a patient app where they can communicate with HIPAA compliant, that they can send pictures at any time, and they can reach us at any time, even if it's the middle of the night. They will wake us up and ask us, right, what's going on. So that's always comforting for the patient and for me too, because I want to know if something's going on. So the patient will call back whenever they have a question. I normally see them every 3 months anyway, so I'm going to be looking at them, right, on the next couple of months. So I don't set up a follow-up appointment for Skinvive. And then following instructions, same as whenever we do any other filler, right? It is an HA filler, right? So excessive swelling, excessive bruising, any bruising that it's painful, any blanching of the skin, any other symptom that we normally tell the patient whenever we do a filler, even if it's a completely different layer of the skin that we're treating it. So same instructions, same kind of like precautions, right? As well as when you're doing the treatment, you need to be kind of like watching for blanching or patient complaining of pain, or just like whenever we are doing any deeper fillers. Mm-hmm.
I know you talked about how you do it for the new patients, but like somebody's coming to follow up for Botox, how do you kind of upsell that?
So I tell them that we have this new product that is approved by the FDA for skin quality. And those patients are very receptive because at that point, they're patients that they trust you already. So those are great patients to kind of like introduce it to. And you're seeing them every 3 or 4 months anyway. So it's a great addition. Like every other treatment, they will probably throw in their Skinvive in through into their treatment. And if you guys have any questions, just put it in the chat box and we'll answer them through the app.
And then, JC, can you talk about your experience? Like, how did you feel? What do you
Your
think
skin
about
really looks good.
Let's get what we get over here. I wish we did the house.
It does. Oh, yeah, that's true. We did it. Sorry, JC. I completely forgot.
Oh, it's okay.
Uh-huh. And again, I normally tell my patients, it's not what you're going to see right now. Probably what you're seeing is just a little bit of the swelling of the product, but more what they're going to feel. The skin is going to feel like smooth and soft and plump. It's awesome. It's hard to tell in pictures unless you have a VCA where you can see the size of the pores and all of that, like really, really detailed. I think with pictures it's hard. It's more what the patients are going to feel.
It definitely has an effect right away, though.
Yeah. It looks really good.
No, it wasn't bad. That there was this
Exactly.
and the other was okay.
Exactly.
Yeah.
So definitely in that area
It's
that it's
so
a little
fast.
bit
I mean, it's
a
not-
little bit tender. Definitely new needle, right, for that little area, so it's less uncomfortable. I try to leave it at the end. Just try to treat everything else, and then really quick do that little
But it's
area
fast,
at the end.
yeah.
But it's really not that bad. It's not that bad.
No.
It's a 32 gauge needle. So it's a deep dermis injection, and it's a 45-degree angle. And if you're pushing a 0.05 of product, you're barely gonna see kind of like a little bleb, kind of like forming. That means that you're in deep dermis. If you're pushing the 0.05 and you're not seeing anything, that means that you're a little bit deeper. Does that make sense?
Yeah.
So you're supposed to see a tiny little bit of bleb kind of like forming at that 0.05. That means that you're in deep dermis.
Would that be like half the needle?
No, it's probably like a quarter. Yeah, I will say like a quarter of that needle. And I've seen some injectors using the mesotherapy needles that are really, really short.
Yeah.
And going obviously all the way in because it's kind of like almost like a quarter of that half-inch needle. So there's different options, right? When it comes to the treatment, as long as you are at the right depth with the right product, you should have good results.